Good morning, everybody, and thank you for joining us. This is one of our early bird talks today, and one that I particularly found very interesting myself. Our topic of discussion today is ADHD in the workplace. We'll start by just making sure that everybody knows what ADHD stands for. That's Attention Deficit Hyperactivity Disorder. Now, focus can be hard for anyone. But with ADHD and trying to work can be very difficult. And so we wanted to address some of the issues that are in play for an individual that has ADHD. So let's kind of take a look at our overview of our topic first off. What is ADHD? We'll discuss that. We'll discuss the key aspects of the disorder itself, how it affects a person. And then we'll talk about managing it in the workplace, including things like time management techniques, navigating the relationships of others in the workplace, fostering positive relationships, leveraging ADHD traits for success, optimizing your environment, diet. We'll talk about that a little bit. And then we'll talk about workplace accommodations for individuals with ADHD to include the employee's rights, the process of attaining those accommodations, and the suggestions for employers to support individuals with ADHD. So, what is ADHD? Attention Deficit Hyperactivity Disorder. It's a mental health disorder, and it includes a combination of things that create problems for the individual: inattention, hyperactivity, impulse control, a pattern of inattention and hyperactivity that interferes with your ability to perform daily functions. It can cause difficulty managing tasks, staying focused, being a good manager of your time, completing projects. It can also lead to challenges for individuals not only in the workplace, but in school, their personal relationships, and the symptoms can change as we get older, becoming more internalized, and restlessness can increase as we become adults. So this is definitely something we want to address because as adults, most of us are in the workplace environment. So how do we deal with it? Well, there are some key aspects to ADHD that you need to be aware of. Those key aspects include the inattention that I just addressed, trouble paying attention to details, completing the tasks that may be assigned to you, staying organized, which is going to help you to actually complete the task in a timely manner. That hyperactivity, the restlessness, fidgeting, excessive talking, and being constantly on the go, never sitting still. And of course, you have the impulsivity, acting without thinking. It's kind of the term engaging mouth before inserting brain. It's difficulties with self-control, communicating with others without interruption. And all of these can cause major impact on your ability to perform in the workplace. So, how does having ADHD affect an individual? Well, it can cause an individual to make careless mistakes. It's causing difficulty following your instructions, and we lose our belongings. And I say we, self included. It can affect your ability to function during work and school because people with ADHD struggle with lengthy tasks, time management, and completing projects. Adults with ADHD struggle with that inattention, disorganization, that impulsivity that says, I got to do this. Oh, but I got to do this. But then I got to do this. And so we're kind of moving in several different directions at one time. And this leads to problems with our time management. Again, the inability to focus creates problems with creating or completing tasks, and we forget things. We have difficulty with memory. Not only do these problems or these situations affect our work ability, it affects our relationships with others. We can have difficulty with peer relationships. Like I said, interrupting conversations and appearing disrespectful at times when it's not intentional. And these can cause major strains on your personal relationships and connections with other people. It can affect your emotional well being. A pattern of setbacks can worsen feelings of frustration. Then they cause increase in risk for anxiety and depression. It can create internal versus external symptoms. While kids tend to be more prevalent in exhibiting these obvious stresslessness, adults often experience it as an internal feeling rather than an external display of what's going on. And this restlessness or this needing of constant activity can cause struggle within the individual. So, how do we manage dealing with these symptoms and still be able to work or perform in a work environment? In today's fast-paced and demanding work environments, people with ADHD have some unique challenges. Difficulty with the concentration, as I said earlier. They have difficulty with impulsivity, time management, organization. Navigating the workplace can feel like an uphill battle and an unbeatable complication. However, with the right strategies and support systems in place, managing ADHD in the workplace can lead to good productivity and success. When we develop these strategies, ADHD management can uncover actionable insight for achieving success and fulfillment in the professional environment. Individuals with ADHD also tend to be workaholics. And so this activity can be a means of being very successful. But the things we have to learn are techniques for success. One of those is time management. And so we'll take a look here at the time management techniques that can assist an individual that has ADHD. Many of us are given large tasks, large projects to complete with deadlines, so they can feel overwhelming. That leads to procrastination, avoidance, denial, frustration. And to combat this, the recommendation is that we take and break these tasks down into smaller, more manageable steps. We focus on one step at a time, then we make the progress that we need without feeling overwhelmed by the progress. It's kind of like the old saying, how do you eat an elephant? One bite at a time. Another thing that can help is to use visual timers and reminders. Setting an alarm. Set timers to allocate for specific amounts of time for each task to help you stay focused and on track. Visual reminders also help. sticky notes, digital alerts. These can prompt you to switch from one task to another or one setting to another. Prioritizing is a necessity. Prioritizing the task with the urgency and importance of the project in itself can help you to stay organized. Not all the tasks are going to be created equally. So it's these Eisenhower matrix that help to categorize tasks based on what's urgent, what's important, and what can wait till later. Focus on completing the high priority tasks first. Then tackle the less urgent or less important tasks as your time allows. You want to set clear goals for yourself and deadlines, and make sure that those goals and deadlines are not only clear to you, but clear to the others that you are reporting to. Clear goals and deadlines provide structure and direction, and these are essential for success in the professional world as an individual that has ADHD. It helps you to stay motivated and it helps you to stay organized. Breaking down these larger goals into smaller, manageable milestones also helps. And use deadlines to create a sense of urgency and accountability. So, workplace relationships can be very difficult, whether you have ADHD or not. But building positive relationships in the workplace is essential for professional success. And for an individual that has ADHD, this can be a big challenge. The symptoms, such as the impulsivity, can make it difficult for you to pick up on social cues. And the problem with time management can impact interactions with colleagues and supervisors, especially if you're working on a project with a group of individuals. There's a time constraint and you are the sole individual who is not keeping up with the delivery. With awareness, understanding, and right strategies, an individual that has ADHD can navigate these relationships effectively. So, how do we foster these relationships? One, we develop coping strategies for social interactions. These social interactions can be overwhelming with ADHD, but by developing coping strategies, this can help you to create and maintain positive relationships. Practice mindfulness techniques to stay present during conversations. Take breaks when needed to recharge and seek out quieter environments for one-on-one discussions. It's very difficult to communicate with an individual when you have all of these outside stressors being placed on you. And so if you can quiet some of those thoughts, some of those activities, some of the things in the environment that catch your attention, it makes it much easier for you to focus and be present when having communication with another coworker. Be transparent about your strengths and your challenges. Being honest with your colleagues can help to strengthen your relationship and these challenges related to ADHD. You need to highlight your unique abilities, such as your creativity, your hyperfocus. Hyperfocus can be of a benefit to an employer, to a group working on a project, because this individual that's hyperfocused is going to see the things that others don't. Problem solving techniques, while acknowledging these areas as your strengths, You also need to make people aware that you need support or certain accommodations to be able to accomplish the tasks that you're being held responsible for. So, how do we embrace those strengths? Leveraging ADHD traits for success is one way of embracing those strengths. ADHD comes with its own set of challenges, but it also brings unique strengths. These strengths can be leveraged for success in the workplace. By recognizing and embracing your strengths, individuals with ADHD can thrive in a professional environment. Embracing your strengths can unlock full potential and success in the workplace. So, what are some of the things that we can do to be successful? What are some of these traits that we're talking about? Creativity and innovation. People with ADHD often have a knack for thinking outside the box, and this can generate creativity and solve problems that others can't. Embrace your creativity. Use it to your advantage in brainstorming sessions, project plannings, and problem-solving activities. One of the things that I personally do is I do problem solving using what they call a fishbone diagram that helps you to identify the problem. That would be the head of your fish. And then all of the aspects of the problem would be the bones of the fish, which then lead you to the results or the answer to the problem, which is the tail of the fish. It has to do a lot with Lean Six Sigma process improvement, but it tends to work well for people with ADHD because they're able to visualize the steps and the issues involved in the problem, which helps them in the problem solving activity. Being hyper focused. While it's difficult to focus for for most people with ADHD, many individuals also experience this period of intense concentration. They're in the zone. And when you learn to recognize when you're in this state of hyper focus or in the zone, use it to tackle challenging tasks or projects that are unparalleled in dedicating and improving your productivity. Zone in, identify what you're looking for, and attack it with that hyper-focused ability. Individuals with ADHD, being a little hyper, we are generally energetic and enthusiastic. And oftentimes associates with high energy levels and high enthusiasm are individuals that people go to. We challenge this energy to put it to use in our work by taking on leadership roles, spearheading new initiatives, inspiring your colleagues with your passion and your drive. Our adaptivity and our flexibility. People with ADHD often adapt at thinking on their feet. We're the ones that come up with the solutions on the fly. And that's generally in changing circumstances. Embrace your adaptability, remaining flexible in your approach to work. Continue to think outside the box, readily adjusting to new challenges and opportunities as they come up. So, what else can we do to help us better function in the work environment? One of those things is optimizing our work environment. We want to minimize our distractions. Create a workspace that minimizes external distractions such as cluttered paper, noises, the beeps, bells, and whistles that we don't have to hear or don't want to hear. This might involve using noise canceling headphones, white noise, organizing your desk, using apps that block distractive websites. There's nothing worse than being in the zone, working on a project, and you get a pop-up or an email in the middle of whatever it is you're working on. That distracts you, pulls you away from your focus, and then you have to try and regroup. Using visual aids. These are reminders like charts, lists, sticky notes, and they can help you with important tasks and deadlines and help you keep your focus on what you're doing. We want you to develop organizational systems using checklists. They can be very helpful to keep an individual on track, and it can help you to ensure that you don't forget something. Regularly updating and reviewing these checklists can help to maintain your organization. Other organizational tools are like project management software, tracking tasks, setting deadlines, and collaborating on a regular basis with your colleagues. Other things we can do, communicating with your team. Be open about what it is you need. Communicating with your supervisor and your colleagues about ADHD can help to foster understanding, support, and positive relationships. Discussing accommodations and adjustments that can help you perform better are very beneficial when you have ADHD. Seeking feedback. Regular feedback from supervisors can provide insight to your performance and help identify areas where you need additional support or adjustments. I'm one of those people. I'm constantly saying, how'd I do? How'd this look? What do you think I need to add? By getting this feedback, it helps you to tone in on the areas that you are succeeding in and those areas that you need more help in. Practice self-care. It is important that we perform stress management. Stress can be exacerbated with ADHD symptoms. Engaging in relaxation techniques such as mindfulness, exercise, hobbies, they can all help to manage stress levels, which help you to focus. Making sure that you're getting adequate rest. Quality sleep is essential for cognitive function and focus. Establishing regular sleep routines can improve your overall productivity and your well-being. Considering professional support is also another way to optimize your work environment. Working with a mental health professional can provide strategies for coping mechanisms, tailor your specific needs. It can help to improve your cognitive and behavioral patterns by using cognitive and behavioral therapy. And it's often effective in helping people with ADHD manage their symptoms. And for some, medication can be a helpful component in managing ADHD. It's important that we speak with a healthcare provider to determine what medicines might be appropriate for you in your specific work environment. Diet. Now, I know you say, what does diet have to do with my ability to get my work done on my job? Well, while there's no specific one-size-fit-all diet for ADHD patients, research has shown that specific diet patterns can be very, very helpful in managing the symptoms of ADHD. Current studies have shown a variety of nutrients can improve the ADHD symptoms. Conversely, a lack of certain nutrients can worsen the symptoms and affect your ability to manage your symptoms effectively. You know what I'm talking about. Oh, I'm going to skip lunch and just have a Coke, a bag of Oreos, and a bag of Lay's potato chips while I'm working. That's not going to cut it, guys. We should include fruits and vegetables, rich in vitamins, minerals, antioxidants to help brain support and brain health. Some research has shown that symptoms of inattention associated with ADHD can improve or not improve, but increase the consumption of fruits and vegetables. We tend to do better when we eat healthier. That makes sense. According to the CDC, adults should have at least 1.5 to 2 cups of fruits and 2 to 3 cups of vegetables per day. And Lay's potato chips don't count. We need whole grains. We need complex carbs to sustain our energy levels. They're found in many of our foods. Our fruits like apples, kiwis, berries, whole grains such as oatmeal, brown rice, quinoa, and barley, whole wheat breads or pastas are all good for people with ADHD. Legumes such as peas, beans, and lentils. These types of complex carbs have less sugar, which create less of a blood sugar spike, which helps you, one, to feel full longer and helps to improve your focus and attention. By avoiding simple carbs, sugars, white flour, you can reduce the specific symptoms ADHD, especially hyperactivity. And yes, people say, oh, sugar doesn't make you hyper. Yes, it can, because sugar is the body's #1 fuel source. And an excessive amount of fuel causes the engine to rev. We want to make sure that we're getting lean proteins. This helps to regulate the blood sugars because protein slows the digestion of carbohydrates. Therefore, you're not getting this big dump of sugar in the bloodstream at one time, but you're receiving that over a longer period of time, which provides higher energy levels over a longer period. The proteins we're talking about are things like eggs, lean meat, milk, cheese, nuts, soy, tofu, low-fat yogurts. These foods can help to maintain a feeling of fullness and prevent the spikes in the blood sugar levels that we're just talking about. Research has shown that having a protein-rich breakfast can help enhance your mood, your attention, and your alertness. So when the question comes up, are protein shakes okay for people with ADHD? Yes, yes, they are. But we want to make sure they're low in sugar. Healthy fats found in nuts, seeds, avocados, they promote brain function. These healthy fats, such as our omega-3 and omega-6 fatty acids, can help support your heart health, your memory, and your immune system. Some of those those omega-3 fatty acids that we're talking about, fish, flaxseed, chia seeds, these help to reduce the hyperactivity and the impulsivity that we feel with ADHD. The foods we want to avoid. I know when I did this presentation and I start putting together some of these pictures and I think about some of my coworkers in the past, and I think, no wonder they're having struggles because the foods that they are consuming are exactly the foods that we need to be avoiding when we have ADHD. The sugary drinks and processed foods cause these blood sugar spikes, crashes, which lead to mood swings and difficulty in our concentration. Artificial sweeteners. Artificial sweeteners are not as good for you as some people think. They may have adverse effects on our attention and our behavior. And the more artificial sweeteners that we take in, the more the body craves. Because what we've done is we've tricked the palate, but not the brain, because the brain wants energy. Artificial sweeteners don't produce energy. Sugar produces energy, and therefore the brain craves carbs. Caffeine. Caffeine can be a real problem for people with ADHD. It can increase the anxiety and the jitters in some people. And alcohol can worsen the ADHD symptoms and interfere with your sleep. So these are all the things we want to avoid. There are specific dietary plans that are recommended for individuals with ADHD. One of those is the Mediterranean diet, and it emphasizes what we just talked about, especially fresh fruits and vegetables, fish, whole grains, and olive oils. The DASH diet, which focuses on fruits, vegetables, grains, and low-fat dairy and low sodium. There is a ketogenic diet. Ketogenic diets are high in fat, moderate in protein, but low in carbs. Other considerations regarding our diet patterns are staying hydrated, drinking plenty of water throughout the day, eating regular meals. This helps to stabilize the blood sugar and can improve your focus. Limiting your screen time. Can't talk today, guys. Excessive screen time can interfere with your attention and your sleep patterns. It's important that we discuss our dietary changes with a healthcare professional. That could be a registered dietitian. It could be your primary care physician. If you have other issues or other health conditions, it could be a patient educator like myself. But it's important that you have an understanding of we are what we eat, and what we eat has either a positive or a negative effect on our bodies. In some of my other classes, we talk about food as being one of two things, and that there's very little difference or very little gray in the middle. Food is either your medicine or it's your poison. And we have to decide what our medicine is to be productive in the workplace. So developing healthy eating habits is going to be very important. And it can be very elusive to an individual that has ADHD. Studies show that we make dozens of decisions about our food and eating every day, each one demanding strong, exclusive, executive function. What do I eat today? What choices do I have? How long do I have to eat? How hungry am I? What did I have yesterday? All of these thoughts just kind of overwhelm you. And so it tends to make it very difficult. To devise and stick to a healthy diet, our ADHD brain must anticipate, plan, coordinate, and follow through on smart food choices. Again, our medicine rather than our poison. When we fall short, we feel demoralized, we blame ourselves, when in reality, it's our ADHD symptoms that are the culprit. And so, like with other disease processes, individuals with ADHD have to plan their meals. The night before work, I need to plan. What am I going to have for breakfast? How much time am I going to have for breakfast? Is this my medicine? Or am I sabotaging my workday by consuming my poison first thing in the morning? Eating habits. I thought these would be a little helpful, and I found them very interesting. Practicing mindful eating. Adults with ADHD rarely practice mindful eating. That is, thinking about what they're going to eat, how much, when, where, etc. They tend to eat more calories than they're aware of, and they consume fewer healthy foods. They tend to eat larger portions, even when they don't like what they're eating. And before making any changes in their diet, you got to really be honest with yourself and assess what your eating habits are. Are you the chip eater? Are you the impulsive eater? We've got to curb our impulsive eating. It's a hallmark trait of ADHD that we are impulsive, and it shows in our eating habits. Adults with ADHD tend to eat their food faster, which can lead to overconsumption. Your stomach doesn't have enough time to send the signal to the brain that you're satisfied, which then can lead to other health problems, obesity, hypertension, diabetes. All of these can be a negative side effect from this impulsive eating. We want to avoid the emotional eating. And you guys know exactly what I'm talking about. Every one of us can relate to that time when we are just so frustrated or so sad or so upset. And that carton of Bluebell ice cream is just calling your name from the depths of the freezer. This is common among adults who have ADHD that struggle with emotional regulation. So we have to learn to distinguish between eating for our health and eating to drown our emotions. We should allow the label on the food to guide us, to help us to decide, is this my medicine or is this my poison? And we want to eliminate the guesswork. So the labels on the food are going to help you to identify whether it's medicine or poison. And we should always have some healthy staples on our shopping list. We should stock the healthy foods in our house. You're less likely to want the potato chips if you don't have the potato chips in the pantry when you first open it and they're calling your name. Reading the labels tends to be something that most people don't do. They buy what they like, they buy what they know, or they buy what they see on commercials. So we tend to underestimate the number of calories, the amount of fat, the amount of sugar in our foods, and what we're actually putting in our body. And so if we're getting takeout, we do the same thing. We have no clue what's in what we're ordering. So it's important that we ask the questions. We ask for low fat. We ask for low sodium. We ask for sugar free. And we don't want to eat something that is more impactful on the body than it's going to do us good. Lastly, we don't drink our calories. What I mean by that is the consumption of alcohol generally contains high levels of sugar. And alcohol can cause a rebound effect, causing, first of all, low blood sugars, which can then destroy your focus, your ability to perform. And then once the alcohol has been metabolized, it dumps large amounts of sugar into the bloodstream, which then causes these sugar spikes, which can increase impulsivity, jitterness, lack of focus, fatigue, and all sorts of other problems to exacerbate the symptoms of ADHD. So we don't want to drink our calories. We want to eat our calories. And so, fifthly, hold the big picture in mind. Adults with ADHD have their best intentions in mind, but they fall short of executing those intentions sometimes. And we need more than just intentions to get things done. Individuals with ADHD face a heightened risk for eating disorders. Most notably are bulimia nervosa and binge eating disorders. And according to a growing body of research, we're finding that as individuals get older and have gone through life with this eating larger amounts, eating faster, eating high fat, high carb foods, we are seeing an increase in the number of people with ADHD who develop these eating disorders. What's more, these eating disorders appear to grow in severity alongside your ADHD symptoms. And for us to be successful with our eating habits, we need to plan and to build healthy habits beyond just our eating. So when we talk about accommodations, there are accommodations available to individuals with ADHD in the workplace. When we request these accommodations, we start by identifying the specific challenges we are facing and the adjustments that could help us improve our productivity in the workplace. We need to schedule a meeting with your supervisor or your HR representative to discuss those needs. We need to be clear about how these accommodations will help you to perform better, creating flexible work hours, quiet workspaces, the use of organizational tools, additional time for deadlines, and regular check-ins or a mentor to help stay on track and stay focused. Reasonable accommodations. What are reasonable accommodations for ADHD? Well, environmental changes like a quiet workplace or noise canceling headphones, scheduling flexible work hours or flexible start and end times, or working remote. Assistive technology like timers and reminder apps. Task restructuring like breaking down large projects or delegating marginal tasks or focus so that you can focus in on the core duties that you've been made responsible for. These adjustments, these accommodations are individual and they are aimed to reduce distractions and improve your time management and organization, but must not cause an undue hardship on the employer. So there has to be a balance. And a lot of individuals either don't know that they are entitled to these accommodations or that there are limits to these accommodations based on the undue hardship for the employer. So, what are your rights? What accommodations are you legally able to ask for? Well, ADHD is legally protected under the disability laws. The Americans with Disabilities Act provides protection from discrimination in employment, meaning that you cannot be denied employment because you have ADHD. It ensures that individuals with ADHD have equal opportunities to work. Employers may be required to provide reasonable accommodations for an individual. This was established as of June 23rd, 2025. Okay. The may is what you need to be aware of. Workspaces with over 15 employees are legally obligated to provide workplace accommodations. What the those 2 points mean is basically if there's more than 15 people working in a workspace, the employer is required to make accommodations. But if there's less than 15, that employer has the right to decide whether or not they make those accommodations based on whatever strain that may cause the worker, the job or the employer. So what is it that employers can do to help support people with ADHD? Accommodations are just one aspect of creating an inclusive workplace environment. There are some other things that employers can do to help support people with ADHD. That includes them actually learning about ADHD and the effects that it has on an individual, on a particular task or operation. Learning about the positive aspects of ADHD, such as the creativity, the problem solving, the hyper focus. That individual may be your number one candidate for a lead position. Encouraging and valuing neurodiversity in the workplace. Basically, what that means is encouraging individuals to think outside the box, thinks differently. The what if we tried thought process. Structuring a work environment in a way that makes use of the individual's strengths, not their weaknesses. Being tactful when discussing an employee's ADHD. Listening to the employees when they are describing what they need. Allowing them to complete tasks in a way that suits them, even if it looks different from how other people are doing it. If it's a different path, but you get the same results, what difference does it make? Assigning a realistic workload with adequate time to complete tasks. All of these are things that an employer can do to help support an individual with ADHD to help to make them productive and successful. So that kind of concludes the presentation. Before I open it up for additional questions, there were some questions that were posed that I'd like to address that we just kind of touched on in our presentation. One of those was, how far does an employer go to meet the needs or accommodations of an individual with ADHD? That can be a difficult question to answer. But because that individual has legal rights, it is very, very important that you work with your HR department to address the issues that you have with an individual with ADHD, because there are specific accommodations that are pertain to the number of employees, the individual's needs, what you are able to provide in accommodations. Your HR department is going to know all of those things, and they're going to know possibly more about your employee than you do. And so it's important that you work together as a team to support that individual with ADHD. Another question was posed about an individual who does not have a formal diagnosis, but shows many of the symptoms of ADHD and is looking for accommodations. Well, in order for the employer to legally be held accountable for providing those accommodations, you must provide documentation of the disorder. Meaning, if you don't have a formal diagnosis, get a formal diagnosis. That's the only way to ensure that those accommodations will be guaranteed for you. I believe I have addressed all of the questions that were posed to us earlier. We're going to open up the line now for you guys to ask any additional questions that you may have. Heather, I'll let you take it from here.
You can place yourself on, you can take yourself off of mute to ask the question, or you can post the question in the chat.
Do we have any additional questions?
I don't know if you touched on this one, but one of the questions had to do with before is how to communicate with people with ADHD via text message.
Ah, yes, that's a very important one. Because an individual with ADHD can be one either hyper-focused or not focused, communicating through text is not the most advisable way to communicate. The reason being, the individual may miss something in the text. The individual may interpret the text differently than what you're trying to communicate. So it's recommended when you're trying to, especially when you're trying to provide direction, instruction, deadlines to an individual with ADHD, it is best to do that in person. Because providing the type of detail in order for the ADHD employee to focus in on what you're trying to accomplish, you may lose them in the process. You're going to be sending a 4-page text message to make sure the individual gets everything you're trying to communicate, when in fact it would be much easier to communicate with that individual in person. That allows them the opportunity to make notes, to ask questions, to make sure that they have clarity in what it is you're communicating. Any other questions?
Okay, you did answer the official diagnosis piece. I'm looking through the other questions that I had highlighted to make sure.
Okay.
What are some ways to deal with the lack of availability of ADHD medication due to back orders and shortages?
Unfortunately, that is a situation that we are seeing nationwide at this point. Not all of the medications that are prescribed for individuals with ADHD come within the United States. And so with some of our current political issues that are occurring, we're not getting the medications from outside of the country that we were getting previously due to tariffs and delays and things of that nature. So that has become an overarching problem, not just for individuals with ADHD on medication, but a number of different diagnoses and disorders are experiencing the same problem. One of the things we recommend is, because there's such a delay, it's very important that diet, rest, and exercise become a primary component of helping to manage the ADHD. I really don't have another answer for you, because that's something that is outside of your or my control. but you can help to decrease the symptoms of ADHD by doing the 3 things I just said. Making sure you're getting plenty of rest, eating healthy, regular meals, and making sure you're getting exercise. Any other questions?
Those are the ones that I had highlighted that were not addressed in the presentation. So are there any other questions that anybody else has? No, ma'am.
No? Well, if not, thank you guys for once again joining us. I certainly appreciate your time and attention, and we look forward to seeing you at our next presentation. That's one of my favorite talks, diabetes awareness. I am a diabetic also and have been for over 50 years. And so I look forward to sharing some more information with you and sharing a quick recipe on a healthy snack for individuals with diabetes. So until we meet again, you guys have a great day, a great rest of your week, and a great weekend. Thank you.
Thank you for joining us. Bye.
Bye-bye.